Good day everyone, my name is Dr. Uzor Angelina and this week is the World Antimicrobial Awareness Week. The theme for this year's WOW or World Antimicrobial Awareness Week is Preventing Antimicrobial Resistance altogether. We all know that diseases are caused by various microbes like bacteria, viruses, fungi, protozoas, but I'll be focusing on antibiotic resistance today because it's a major problem. It's a growing public health problem in Nigeria. What are antibiotics? Antibiotics are a group of antimicrobial agents that are used in treating bacterial infections. They are active against bacteria, and because of that, they are used to treat all sorts of bacterial infections. And this means that antibiotics cannot fight viruses, they cannot fight fungi or protozoa infections. So when you have a common cold or you have a flu, antibiotics are not necessary because this common cold and flu, they are mainly caused by viruses, and viruses are usually self-limiting, and then your body immune system is able to fight them off. Next, we want to talk about how bacteria develop resistance to antibiotics. Bacteria are able to develop resistance to antibiotics through genetic modification. The bacteria are able to change their DNA. They usually do this in an attempt to avoid destruction and also for survival. So what are the drivers for this antibiotic resistance? When we misuse and when we overuse antibiotics, for example, you come to the hospital, you have a fever, you have a cold, and then you're telling the doctor, you must prescribe antibiotics for me, and then you go ahead and then take antibiotics for this. Or probably you have a stomach pain, or you have whatever complaint it is that you have, and you just go ahead, go to the pharmacy and request for your ampiclox or ciprofloxacin or whatever antibiotics it is that you think is appropriate for managing your problem. So overuse, misuse, self-medicating antibiotics causes them to develop resistance, causes the bacteria to develop resistance. Another thing that causes it is not completing your medication or overusing your medications. You've come to the hospital, your doctor has prescribed a drug for you to take twice daily for 7 days. Then you take it for the first 2 days, you feel better, and then you forget taking the drugs. This causes antibiotic resistance. Or the doctor has given you the drug to take for 5 days and you feel like, oh, you're not well enough, you go ahead and extend it by yourself for probably an additional 3 days. This also causes development of resistance to antibiotics. So another thing that causes resistance, antibiotic resistance, is improper sanitation and hygiene and poor infection controls, especially in our hospitals and clinics. You know, antibiotics are also used in farm animals to prevent infection and also to enhance their growth. And we as humans, we consume these farm animals. When we do so, we take in some of the antibiotics that they've had, and then it also develops resistance in us. Next, we want to talk about the consequences of antimicrobial resistance. What are the consequences of antimicrobial resistance? Antibiotics become ineffective. This is a major problem with antimicrobial resistance, and it becomes hard to treat certain infections. Also, certain infections that were once treated with simple or a particular group of antibiotics will now require an alternate group of antibiotics to treat them. This alternate group may be more expensive, especially for the patients, and then this alternate group may actually be a group of antibiotics that have probably been reserved for treatment of severe infections, probably because of their side effects or their therapeutic window. So we don't want this to happen, and that is why we have to try to prevent antibiotics from developing resistance. Other consequences of antibiotic resistance is that it leads to longer duration of treatment and, like I said earlier, ineffective treatment, and it can consequently lead to death, especially for patients that probably have had long surgeries, are on chemotherapy, or had an organ transplant. Development of antibiotic resistance is a major challenge in such group of patients. Lastly, as a society and as a community, what can we do to reduce and to prevent this antibiotic resistance? Firstly, we can maintain good hygiene, good hand hygiene. Learn to wash your hands all the time. You can also maintain good sanitation and hygiene, and then in hospitals and clinics, good infection control is important to prevent antimicrobial resistance. Next, avoid self-medicating. Please try to avoid self-medicating. Don't take antibiotics without prescription. Try to get tested before starting any antibiotics. It's important to get tested before starting an antibiotics because probably the antibiotic you want to use to treat a certain infection is already resistant to it, or is not sensitive for that particular bacteria causing the infection you want to treat. So it's important to get tested to even know if the infection you want to treat actually requires an antibiotic. So try and get tested before you start treatment for antibiotic. You can always ask your doctor to help you about this. Ask your doctor questions. Get tested before you start your antibiotic treatment. Avoid self-medicating. Try to get all your approved vaccines. Try to get vaccinated against certain infections so that you don't have to treat them. Vaccination is important. Learn to complete your antibiotic regimen. Yes, I said it. Please, let's learn to complete an antibiotic regimen. Whenever a doctor prescribes an antibiotic for you, try as much as possible to complete the treatment of the antibiotic. Lastly, I would like us to, as medics and as doctors, to prescribe antibiotics responsibly. This would also help in preventing antibiotic resistance. Thank you. How do we prevent antimicrobial resistance as a community and as a society? We all have a role to play in preventing antimicrobial resistance. Firstly, let's learn to wash our hands. Yes, wash your hands to prevent spread of infections. Let's learn to maintain good sanitation and hygiene. In hospitals, we can maintain good infection disease control. Then please stop self-medicating. Stop it. It causes antimicrobial resistance, and then when you need the antibiotics later on, you might have developed resistance to them. Stop self-medicating. Before you take a drug, before you take an antibiotic, always consult your doctor and always get tested. It's important to test for antibiotics because different antibiotics work for different bacteria. So if you do a test, you might be able to find out that the antibiotic is resistant to the bacteria or is sensitive to the bacteria causing the infection you want to treat. So it's very important to get tested before you commence antibiotics treatment. Also, getting tested will help you to even know whether altogether the infection you are trying to treat is caused by a bacteria or is caused by something else. Not every infection is caused by a bacteria. Some infection can be caused by viruses and fungi, like we rightly stated. So getting tested will help you to know whether the infection is caused by a bacteria. Stop self-medicating and use your antibiotics appropriately. Also, try to ensure that you get all necessary vaccines. Yes, it's very important to get vaccinated. Try to get all necessary vaccines. Lastly, complete your antibiotics regimen. If your doctor has prescribed an antibiotic for you to take for 5 days or for 10 days, please ensure you complete your antibiotic regimen. Even though you feel better, it's important that you still complete your antibiotics regimen. And as physicians, one thing we can do to prevent antibiotic resistance is to prescribe antibiotics responsibly. Thank you.